5 seconds. Mics are hot. You're live.
Good evening. This is the Auburn Finance Committee. Today is March 19th, 2025. It's 5:30 PM. Before we call the meeting to order, let me just read our remote participation script. This open meeting of the Town of Auburn Finance Committee is being conducted both in person and remotely, consistent with Chapter 107 of the Acts of 2022, which suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely as long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. For the public to join the meeting remotely by telephone, it's 1-786-535-3211 with an access code of 991-599-357, or the public can join via computer at global.gotomeeting.com/join/991-599-357. All supporting materials that have been provided to members of this body are available on the town's website. The public is encouraged to follow along using the posted agenda. Please note that this meeting is being recorded by Auburn Cable Television. Permit me to confirm that all members and persons anticipated on the agenda participating are present and can hear me. Members, when I call your name, please respond in the affirmative. We have Patrick Jones.
Here.
George Graham.
Here.
Stephen Consiglio.
Here.
Andrew Shar.
Here.
Town officials, employees, when I call your name, please respond in the affirmative. CFO Town Accountant Karen Harnoy.
Here.
And Administrative Assistant Danielle Chamberlain-Roberts.
Here.
Thank you. If we did have anybody participating remotely, we would conduct any votes via a roll call. So the agenda for this evening, we do not have any transfers. We'll move right into our FY26 budgets, operating and capital, and review those. First on tonight's agenda is the Fire Rescue Department. We have Chief Coleman and Deputy Chief Johnson.
Good evening, Mr. Chairman, members of the committee. I do have a handout for you that we can use as a guide if you wouldn't mind. Taking one of them for the handout as well. So, Mr. Chairman, there is information in this handout that I don't plan on covering all of it, but it is information that the committee can review at a later time if you want. It's just more of an in-depth look as to what's been going on within the Fire Rescue Department over the past year, some trends and things like that. But we can use this document. It is in line with the budget lines, so we can just flip through and use the line items with this document. So I'll just start off by saying that 2024 was another very busy year for the Fire Rescue Department. We ended the year with 5,322 emergency responses. We looked today, and as of this date, just about to wrap up the first quarter, we're about 130 calls ahead of where we were on this day last year. So the call volume, as you can see, on this chart over the past 10 years, we've had a steady climb in our call volume growth. I did provide some information. Again, I'm not going to read all of this, but I just provided some information for the committee in terms of the working groups. Just as a refresher, there are 4 working groups. There is a captain and 2 lieutenants assigned to each group, and then with a number of firefighter EMTs and paramedics that are assigned between headquarters and Station 2, and then the fire prevention division. Page 3 is just an overall organizational chart of the department and all of its divisions. And I provided an operational overview page just in terms of the number of positions. This is a total number of positions within the department, from the chief down to probationary firefighters, and it also includes our administrative staff, the fleet mechanic, and it also includes one Bay Path High School co-op student from the automotive department who just started work today with us in the fleet services. So we're happy to have him with us. So within the department, much of the on the staff side falls under what's called the Bureau of Community Risk Reduction. It's fire prevention, it's public education, it's EMS, all of those things. So when we talk about staffing, Right now, all of the groups are assigned at 11. They're assigned at 11 members. So you can kind of see, we tried to make it a little easier to kind of depict, where people are in terms of, the number of firefighters. And as we've talked about it before, one or two more on a shift doesn't seem like a lot, but it's the difference of either a supervisor's vehicle going out the door to be able to respond to a call or not, or whether or not there are 2 or 3 firefighters on the shift. So right now, our groups are staffed at 11. We do have a minimum of 9. When we operate at a minimum of 9, that means we have 2 firefighters on the headquarters engine and we have 2 firefighters on the West Street engine. Ideally, we should be at a minimum of 3. Ultimately, and we'll talk about it as we get into the firefighters line, ultimately, we're trying to staff to 12, which will give us a little more flexibility in terms of putting either 3 or 4 firefighters on our engine, but it gives us more flexibility in cross-staffing the tower, cross-staffing the rescue, and the potential to put a 3rd ambulance on the road, which we really do need. The amount of mutual aid ambulances that are coming into town and have been, for years, but there is a revenue component to the amount of 3rd ambulance calls, that are going out the door. So there is a revenue component there. But more importantly, it's to be able to provide that medical service within our normal 4-minute response time without waiting for a mutual aid ambulance, to come and transport. So it would be great to have the ability to sort of cross-staff that 3rd ambulance as well. Within the Fire Prevention Division, that office has 2 fire inspectors in it, and they logged 1,493 inspections and other code enforcement actions throughout the year in a variety of occupancies, from residential and retail to commercial and industrial. And that office also coordinates all the hazardous materials requests in terms of what's called a 21E study, when someone is looking whether or not there are underground storage tanks or if there's been contamination on a particular property. That's called a 21E study that is done by Fire Prevention. And also Tier 2 hazardous material tracking. We have approximately 35 businesses in town that have reportable quantities of hazardous materials that they are required by law to report. So the Fire Prevention Office takes in that data, makes sure that it's entered into our records management system. So not only from an inspection standpoint, if that particular business is doing either a quarterly or an annual inspection, but if we have an emergency there, within our computer-aided dispatch system, we know what all of those hazardous materials are in that particular building. So Fire Prevention, it's about 35 that have reportable quantities. So I'll give you an example. A place like a Jiffy Lube or something like that, they don't have reportable quantities. So these are some of the larger commercial industrial buildings that are dealing with hazardous materials by pallets of 55-gallon drums and things of that nature. So it's some of the larger commercial industrial occupancies that are just working in more gallonage than something like a Jiffy Lube. Our emergency medical services coordinator and also community paramedic. And the community paramedic piece, essentially what that means is she operates in a very similar function to a public health nurse. So she works very closely with the Board of Health when there are issues that require medical oversight, whether it's a pandemic or a family that may have a particular illness that has to be reported by the state and requires follow-up care. The community paramedic can do that role. So she works very closely with the Board of Health. And, she basically manages all aspects of the EMS operation. Our training officer administers and is responsible for all fire-related training and activity within the department. They oversee all the probationary firefighters, and they keep tabs on compliance for all of our mandatory trainings, either through NFPA or OSHA. Massachusetts is now an OSHA state. We have been for the last several years. So there's an OSHA component that we have to hold as well. Our Fleet Services Division has been under our roof for a couple of years. It's really working out great. In 2024, they processed 251 work orders through that division. They're the liaison between either the DPW, if there's any assistance or coordination that needs to go on there, the dealers, all the inspection stickers, all of the testing of pumps and ladder certifications, they oversee all of that. And Ken Rabin, our mechanic, received a couple of different emergency vehicle technician certifications this year that are specific to emergency vehicles. So we're very happy and proud that he was able to accomplish that. And like I mentioned, for the first time, we have a Bay Path co-op student working with us. So his name's Aiden, seems like a great kid, and he just started today, so he's really excited. So when you look at the funding sources that make up the fire rescue budget, ambulance receipts does contribute a considerable amount of money. In this year's budget, in FY26, there's a little over $1.1 million from ambulance revenue that goes into our operating budget. And that 1.1 covers a variety of things, including a total of 12 firefighter salaries. It covers a percentage of overtime expense, license and certifications, technology support, medical director, clothing, medical supplies, and then the little stars that are next to them. If it's a single star, it means that it's funded fully through ambulance receipts, and if there's 2 stars, it's a portion or a percentage from ambulance receipts. The ambulance receipts also covers all EMS-related CIP, including our ambulances, so 100% of the CIP as well on the EMS side. Another funding source that we have had over the last couple of years is what's called the Certified Public Expenditure, or the CPE program. The CPE program is essentially a Medicaid and a Medicare program. When we go out and transport a patient that has Medicare or Medicaid, it's paid out at a reduced rate. It's a flat rate of $400. So regardless of what we do on that call, it's a $400 flat fee. The state recognizes that that $400 does not even come close to covering the expenses of that truck and the equipment and all of those things. So through a very extensive grant process, and both the deputy chief and Tess, the EMS coordinator, on an annual basis, there's certain metrics that we have to track, in terms of right down to like mileage and fuel and things like that. And we can essentially apply for a grant through the state based on the Medicare and the Medicaid patients that we transported. And then we'll get an additional reimbursement from Medicare and Medicaid, sort of as a, hey, we get that we're not paying you really what this is worth throughout the year, so we'll give you a grant opportunity. And only those communities who participate in the grant program receive funding. And the grant program is very complex, and I think it's designed that way in hopes that departments say it's not worth it for the extra $150,000 or $200,000 that we're going to get, and they don't do it. But we do. We take advantage of it. And that CPE program is what funds the EMS coordinator position, and it will also fund that Bay Path co-op student. So I think this year's CPE, I think it's around 150, somewhere around there. Just under that. So I think just under $150,000 will be our CPE reimbursement this year. The next page is an activity tracking report for fiscal '24 in terms of our ambulance revenue. So, you'll see that the total charges that we bill out is certainly much greater, 3 to 4 times greater than what our actually total collected is, because there's a difference between charges, what's allowable, and then ultimately what's collected. So when you're looking at the main players, in terms of Blue Cross, Medicaid, Medicare, or other insurance like Harvard Pilgrim or Tufts or something like that, we have a 90% collection rate on those sort of larger insurance payers. And that makes up about 96% of the revenue that we actually complete. As you start to go down and you get into the Veteran Administration, or you get into the self-pay or the uninsured, you can see that the collection on those is, it diminishes when you're talking about self-pay and things like that. So for FY24, we collected $2,068,610.57. And I think right now, the CFO can correct me if I'm wrong, but we have in the ambulance appropriations account now somewhere between, I think it's like 4.5 million, maybe close to 5 million in the ambulance appropriations account.
I'm not sure it's as high as 5 million.
Yeah, it's somewhere maybe 4.5 million that is in the ambulance revenue account at this point. So these are the various line item descriptions, that we have within the budget. I'm not going to go through every one of them. Certainly, if you have a question on any one of them, ask, but I want to just point out the ones that are, a little higher dollar value. So we'll start at the top, we'll go right down. So in this year's budget, the only contract, the only employee in the building that has a contract is me. The other employees, the other union employees between GEU and the firefighters are currently at the negotiating table. So there has been no cost of living adjustment applied in this budget. Whatever cost of living the town has set aside in the reserve account, but that number is unknown at this point. So you have the fire chief's salary, the deputy chief's salary, and like I said, the administrative assistants and the principal clerk that don't have any cost of living adjustments at this point. Account code 202, some of the larger items within that section. What I wanted to provide this year, and we kind of talk about it on an annual basis, but I wanted to just give you sort of a snapshot of what it means when I say, and when we're looking at building maintenance and supplies, that's recommended by the manager at $45,000. So within the budget, we have known expenses that we're going to have out of that line item on July 1. That's where our bottled water comes from. We have garage door service maintenance agreements, HVAC service, Plimo vent service contract, which is our vehicle exhaust system in both stations, our SCBA air compressor, the hood cleaning in the kitchen, pest control. Masterman's is where we buy all of our cleaning supplies right to uniforms. Our uniforms even come from Masterman's. It's a different line item, but our average supply budget is about $500 per month for both stations. And then state industrial, that's all of our soap dispensing, right from hand soap to car soap. So you can see that on July 1, we have an estimate of just shy of $19,000 that would come from that 45. That's anticipated throughout the course of the fiscal year. So then you would have the balance of that money then essentially divided between two stations, and that's what you have for sort of unanticipated things or problems or maybe something new that you wanted to try to buy throughout the course of a year. Professional development, there's only a few line items within our budget that we are able to actually start from zero and do a zero-based approach because like the building, it's sort of unpredictable. We have estimates, but professional development is an example of a line item that we are able to do from zero base because this particular line is the reimbursement for all of the EMT and paramedic research, including their pediatric advanced life support and their advanced cardiac life support recertifications, which is contractual. So with the amount of employees that we have, we're able to derive to an exact figure in terms of what that payout is on an annual basis. Dues and meetings, this is another account where we're able to do zero base. These are all of the different professional association dues or meetings that myself or the deputy or the fire inspectors or our training officers, the various groups that we're a part of. So again, this totals $17,911. Those are exact expenses. Technology support is another zero-based line. Technology within the department has expanded over the past couple of years, and when we get into the CIP, I want to give the committee a little bit of an update on our radio project, which has been going on for several years, and we're starting to see the light at the end of the tunnel. I'm hoping by the end of this calendar year we're fully on board and completed, but we've had some significant improvements to our radio system, but I'll talk about that in a little bit. But technology has certainly advanced within the department. Everything, as I'm sure, much like it is in your own professional lives. Everything is tech-driven. So this is a list of all of the different pieces of technology that, again, run from the copy machines that are both at West Street and headquarters down to the interface software that we need with the computer-aided dispatch system from the 911 Communication Center, to our records management system, to, as an example, something like LogRx, or LogRx is a medication narcotic tracking system. So the FDA has very strict rules and regulations on how narcotics are stored, dispenses, who accesses them. So this particular system, in the event that they're either not checked or they're checked as short, it actually sends notifications to supervisors saying, hey, narcotics haven't been checked, or there's a problem with the narcotics. So, the world in general has become very tech-driven, but public safety and emergency services have become very tech-driven. And in order to be able to stay efficient and innovative, the amount of technology has certainly expanded over the years. And basically what we did is anything that's EMS-related that's here in technology, that's the portion of the technology budget that's covered from ambulance receipts, is essentially tagged to that. When we get down to the payroll accounts, again, the firefighters are currently in negotiation, so no COLA adjustments have been made. And in this budget, my original budget submission for this fiscal year, I asked for 4 new firefighter EMTs, and they were originally budgeted to start in September. There was a couple of month hiring delay. Through the review with the town manager, that request was reduced, so this budget reflects a reduction of 2 positions from 4 to 2, with a January start versus a September start. So again, like we talked about in the beginning, we're trying to move the needle to get to a more appropriate staffing so we can have appropriate staffing on the engine, but we're also trying to get this additional staffing to try to hold the overtime as well. So there is an overtime component with that. Firefighters education, this is another zero-based account. We have 33 members that have college degrees, and contractually, depending on whether they have an associate's, a bachelor's, or a master's degree, they get an educational stipend. So that is a zero-based account as well. Overtime. So as the committee knows, the deputy chief presented an overtime study, comprehensive overtime study that included 29 outside communities, 30 including the town of Auburn. And what we looked at was, what is the total percentage of overtime based on the total salary line item, and what were the budgeted overtime amounts and the actual spending. And as we saw, the budget was very much underfunded in that line. The average overtime budgeted was $900,000 in communities that responded between 5,000 and 6,000 calls annually. The actual was somewhere around 1.1 million. And as I had told the committee the night that we presented that, I'm not going to come here and ask for 900,000. I don't think we need 9. I don't think we need 8. I don't even think we need 7. Right? When we get to 7, we're at some sort of a crisis. We're down employees. We have something major that's going on. So the budget request that I made to the town manager of $618,000 was representative of 15% of the total salary line item, which essentially is what the average was from that study. The departments that responded to between 5,000 and 6,000 calls annually, it was 14.9% that's how the overtime was budgeted. So I requested 15%, and then the recommended from the manager is 618 to 600. I am comfortable with that number. When you look at what our overtime is today, we are trending down. In the height of when things were really bad, our weekly overtime spending was anywhere from 20 to 22,000. The last several weeks, we've been anywhere from 8 to 10,000. We had a couple of members that were injured last week. They were out for a week. Both of them are back. So I'm essentially fully staffed right now, with the exception of one member that is on family medical leave, who I anticipate to be back in the middle of April. But the other thing that, I'll bring that up in a minute. So when you look at what our overtime spending would be in the, like in the situation we're in now, even if we did $10,000 a week, it puts us under the 600,000, but still leaves us, some wiggle room for other things. And if you remember, when we presented that overtime study, much like building maintenance, where we have an anticipated or an expectation on July 1 in terms of what we can anticipate for overtime, we have the same thing with overtime. And I want to say, without looking at the sheet, that number, it's somewhere around $130,000, $140,000 in, training obligations, that are outside the training budget. But there's other things, recalls. So we can predict that on July 1, throughout the next 12 months, we're going to have about 130. So with what we're budgeted at the 600, when you take that 130 into account, I'm comfortable with that 600 number right now. Again, I'll just say, I can't predict the future. I think if in a perfect world, if everybody's working and things are humming along, right, I think 600 is a good place to start. I think next fiscal year, we're going to be able to, we'll see what the year brings, but we'll be able to evaluate it, and we can either give everybody a thumbs up and say, yep, that's a good number, right? We worked within that. But we do know that when these extraordinary things happen and employees, and I lose an entire working group, last fiscal year in FY24, the actual spending was 720. So like I said, 720 was what we spent in crisis. So I'm not going to come here and ask for 720, because that's a crisis number. But I think realistically, based on the study, actual spending, this increase of about $180,000 that I'm asking for, I think puts us in line with where we should be at this point. Mr. Chairman, do you want to kind of pause for questions? Or you want me to go through the whole thing and save questions to the end? I'll take your lead.
Why don't we give you a somewhat of a break?
Yeah,
If anybody has any
that's fine.
questions on the first,
Yep.
first part. Any questions on what we have to date for the fire chief or the deputy chief? Patrick?
I do have a couple, but I'm still formulating my thoughts if someone else wants to step up.
Sure, I'll throw a couple in.
Sure.
Ambulance receipts, so what's reflected here for a total? Some of this, and maybe it is broken out somewhere, is that the total, including what's spent for ambulance receipts? So some of this is coming out of the levy and some of it's coming out of ambulance receipts? Or is that number here at the bottom, the 5.5? No, you have it denoted on here with asterisks as to what is coming from ambulance receipts.
So if you look at, so the asterisks are next to the line items.
Yes.
So if it's a single, it means it's funded completely through ambulance receipts, so like license and certification, or the medical director, or medical supplies. That line item is 100% funded through ambulance receipts. Something like technology, that's a portion of it, and the portion is reflected on what is EMS-driven out of that technology. So it represents about, out of the $80,000 in technology, it represents probably about $10,000 to $12,000 from ambulance receipts to pay for those ambulance EMS-related tech pieces.
I guess what I'm asking is, so if recommended tonight, the 5.5 and change for fire department budget, that is not all tax levy money?
Correct. Out of that 5.5, this year's allocation is like 1,100,000. You have the exact?
I do. It's $1,650,000.
1,650,000.
And it's under the projections part of the budget
Comes
summary.
out of the ambulance receipts, the 1.6 out of the receipts, and then, so whatever that comes out.
Yes, and then the remainder from tax levy.
Is levy, okay. So I guess related to that, just other things, and I'm sure
Excuse
you...
me, Mr.
Sorry.
And it's slightly more than that, because it's 1.6 out of ambulance receipts off of this but it's also within the firefighter salary line. It's a position from the CPE.
Okay.
So
Those are not,
it's, right, so it's slightly more than the 1.6. It would be about 1.7.
are there other things on here that you have not historically tried to put over to ambulance receipts? And is there a reason for balancing a certain percentage? The things that just jump out at me are like the CMed, the Central Mass Medical Control function, $9,000. That seems like that is an obvious ambulance-driven.
So if the D note is not there, let me look.
There's, just for discussion purposes, I'm not saying any
Oh,
specific way.
so it
does not
is. So
appear-
if you look at, just give me one sec. So that's under
Dues and meetings.
dues and meetings.
Does not appear to have anything going towards ambulance receipts, full or partial.
Okay, then that is an error. The CMed dues are covered under EMS, so I'm just missing the D note there.
Okay, and then one other that just jumped out, the professional development, which I don't think has anything noted either. The EMT and medic research, the PALS and the ACLS.
Yep.
Is that something that could be partially funded?
It is, and so, and thank you for catching that, because you'll notice, let me just try to find an example here. So you'll notice that like this professional development line has climbed a little bit because other things like so license and certifications, which is covered under ambulance receipts. The professional development used to come out of license and certifications. So over the last couple of years, the CFO and I have been trying to put things where they're better reflected within the budget on what they are. So that's a good example. So the entire 62,656, that is covered under ambulance receipts, but it used to sit in license and certifications. So again, it's just an example of that missing the D note.
Okay, thank you. Patrick, you ready?
I do have a question. It's more probably to our town CFO. The negotiations, so actually, the negotiations for the salary that are in the reserve account, if we go through the process and the budget goes through in town meeting and then they settle, is there enough amount? I went back and looked at the salary reserve account. It is higher. Is that amount taking into account these negotiations so that the money is there and ready to move if they settle?
Yes.
Great, that's what I thought. And we're comfortable with that amount, knowing that we've got all of these contracts that are going to come up for renewal?
Yes.
Or is it conservatively funded?
I think it's
good.
adequately.
Okay. The 511113 account has, oh, I'm sorry, is that the right, or no, the 51, I'm looking at the two new firefighters in the EMT position for January of 2026. That's incorporated into this budget now?
Yes, but do you have,
Because
yes, the short answer is yes. When you look on the server, there's some numbers on the side that's denoted that doesn't print on the form. But yes, the two positions starting in January are in the firefighter number.
And there was a second part to that question. And that is going to take you from your 11 to halfway to 12.
Correct.
So I'm following. Not 9 or 10 up to 11 to secure it, but to take you beyond 11 for your goal to try to be at 12.
Correct. So two groups would be at 12, and two groups
and
would
then you
still
would
be at
work in
11. And then we would work to
incrementally.
try to get the...
Exactly. I interpreted that way. I just wanted to make sure I was doing that correctly. The Medicare, given the change at the federal level and some of the approaches to reduce or to make up for our deficit, are we concerned at all at the moment with these Medicaid or Medicare trickling down to the state and trickling to you?
So it is something, I
It's gonna
had a
impact
conversation.
ambulance receipts.
Yeah, it certainly would if there were significant changes to Medicare or Medicaid. And I had a conversation today with our billing company about that. So if you look, and I don't think it's blatantly obvious on this, on the tracking report that came from the billing company. Yeah, it's not blatantly obvious when you look at this sheet, but
I think the
roughly
grant
roughly half of our total ambulance
Right.
receipts are Medicare.
That's
and
what I,
Medicaid.
exactly from the example you gave us, and that's what raised the
Yeah.
question. I think it's great that the grants are available, and the math is perfect, but I'm just concerned we have to, as a board, keep that in mind, that could become
Yeah,
something not for now, but just, I like to alert people of the future.
100%. And I can share with you, Mr. Jones, that, I had the opportunity probably about a month ago now to travel with a group of fire chiefs from Massachusetts to Washington, D.C., to the Capitol, to meet with not only our Massachusetts delegation, but some of the other senior leaders at the Capitol, to talk about the legislative priorities of not only the fire chiefs here in the Commonwealth, but nationwide. And Medicare and Medicaid was at the top of the list, because this is a nationwide issue, and fire and EMS departments across the country would be devastated in terms of revenue if there were major cuts to Medicare and Medicaid. So you bring up an excellent point. It's not only something that we need to continue to watch, but I can tell you that at the federal level, it's something that the Fire Chiefs Association, the more global firefighters union, is watching. We have some pending legislation that has been filed here in Massachusetts to try to strengthen the reimbursement of insurance companies just here in Massachusetts. And if hypothetically that were to pass today, that would be very beneficial to us, despite any Medicare or Medicaid changes. So even on the local level at the state, we're pushing for insurance companies to really pay what they should be paying. Insurance companies, they spend more time fighting to not pay you than pay you
So
what would even be
we're looking at
fair.
multiple solutions. We're not
Yes.
just waiting for someone to
We're
make
not
a
waiting for
decision.
something to happen.
That's
so
great. No, those are my questions. Thank you.
You're welcome.
Until you finish the presentation.
Any additional questions on this part?
I just have sort of a managerial question about the overtime as a part of the budget, and like we're trying to get to 12. Is there a situation that would be imaginable where you could eliminate overtime and have a steady crew of 13, so you were starting from 13 and going down to 12?
The thing is, Ms. Consiglio, is you're never going to eliminate overtime, because there's overtime that is derived from outside of just people not being there. There's overtime for training, there's overtime for emergency callback, there's overtime, so there's, I'm not sure if you've seen the tracking sheet, but we track our overtime in 32 different categories, right? So overtime is going to exist even if we had, everybody working. When we have people working and everybody's sort of, there and they're on their normal time off, we're still averaging, $8,000 to $10,000 of overtime a week, even if I have no IOD or sick time. So overtime is a necessary evil in the sense that we would never be able to accomplish what we need to accomplish, whether it's on the emergency side or from a training and education perspective, without overtime. So there's no way that you're ever going to eliminate overtime. When you have 13 a shift, you still have employees that have paid time off. So even if we were to get to 13 a shift, we would have to set the minimum at 10, because we would need to allow 3 people off in order for everybody to be able to utilize the PTO that they're given in the course of a year in order for them to be able to use it. So even if we had, let's say we were at 13 and we only allowed 2 off and we kept 11, mathematically, by the end of the year, we're going to have employees who hadn't had the opportunity to use all of their PTO by only allowing 2 off. So best case scenario, And this is what the staffing study in 2002 recommended. The staffing study recommended that we be at a shift of 13 with the ability to have a minimum of 10, which would then allow us to give our employees the PTO that they're given to be able to use and still maintain a shift of 10, which would be able to consistently put a third firefighter on the engine and still be able to keep the shift commander in the command vehicle. So, yeah, you're not, the best we can do is contain and, you know, staffing appropriately as a way to contain, but you will never, no fire department in the country would ever be able to operate without overtime.
I guess my question is that a political question, like they want the overtime, or would it be easier to build?
I guess I would ask you,
The vacation time and the paid time off, you got to sort of build that into the schedule anyway. So why wouldn't you just sort of build the training time, just like it's another 2 weeks vacation, or, you know what I mean? You have 2 weeks of training, and you have 2 weeks of vacation, or whatever the numbers are. You know what I'm saying? So that would require, you know, it might be you need 15 or 16, but it would change everybody's pressure.
when you say 15 or 16, you mean a shift? Okay, but at some point, right, you have to do the cost benefit on the amount of money that you're gonna need to do 15 or 16 a shift is way more expensive than funding the overtime.
Oh, that's my
for people to
question.
go.
Because, you know, if you're, you know, once you get to, so, you know, before I got here, you know, and last year, everything kind of blew up, and the overtime budget was very low, and you were running very low, which sort of implies that you were encapsulating the training and the vacation time, and you're running, the guys might have been killing themselves, too. I'm not, you know, obviously, the numbers don't tell everything. But that's why my question is whether it shouldn't be, or, you know, just
So-
throwing the question out.
Yeah, I think it's a-
Whether you would
I
have
think it's
more
a miss-
people and less overtime, would that make it operational easier for everybody?
The only way that you would be able to eliminate overtime is to staff the shifts in a way where you could allow people time off to have PTO without backfilling overtime, allow people to have time off to go to training without backfilling overtime. There is a number, but that number outweighs the overtime cost, especially when you're adding benefits into that as well. So,
That's what I was going to add, Chief, that, you know,
Yeah.
the CFO can chime in, that there's that employee cost for salaries. At some point, overtime, it ends up being a little bit more cost-effective once you add in all the benefits, and long-term, you're talking to their, you know, retirement benefits and things, if you have that many employees. So there is probably a balance
yeah,
there somewhere.
and I think there's a bit of a misconception when you say the overtime was low and we seem to be managing. Well, that's part of the problem. We weren't. The overtime was low, but when you look at what the actual spending was, even on the non-critical years, it was $500,000. So that essentially means that we were underfunded in that line by $200,000. So yes, it's easy to look at on the surface and say, well, it seemed like you were managing here and everything was going well. We were doing the same thing. We were dumping transfers into that line. It's just, it wasn't because of a staffing crisis. It's you know, so I understand your point, but that's not really how it shakes out. But yes, the short answer to your question is, there is a number, but that number is far bigger than what the overtime number is.
Chief, could I just, before we move on to the second part, and maybe it'll sort of transition normally, but you've discussed in the past, and I don't know if I appreciate it, I'm not exactly sure. I've got mixed emotions over the graphics. I can't wait to see what the police department brings up for their... But can you just explain, I think there is a misconception amongst folks when they drive by your fire stations and they see apparatus in each of the bays, that if their home is on fire, God forbid, that every one of those doors is going to go up and every one of those trucks is going to be fully staffed and every single one of those pieces of equipment is going to roll towards their residence. Can you just explain that that is not the case based on your current staffing and what some of these indicate as to recommended staffings nationally and things of that nature?
Sure, absolutely. So the National Fire Protection Association, or the NFPA, under Standard 1710, which is the deployment for career fire departments, they not only set the turnout times, there's an expectation that you're going to be out the door in 90 seconds of an emergency, and there's an expectation that you're going to have a response time of 6 minutes. Our response time, greater than 90% of the time in Auburn, is 4 minutes. So we're 2 minutes under what the national average is. But there's another part of that, which is the recommended and the standard is that there should be 4 firefighters assigned to a fire engine. That includes a driver operator or an engineer, someone to actually run the truck. The truck doesn't run itself. So when it gets there, someone actually has to operate the truck. A supervisor, either a lieutenant or a captain, that's in the front seat making the decision, they're in charge, and then 2 firefighters in the back. Right now, our firefighters are staffed with 2, a driver operator and a supervisor. That's what our engines are staffed with. We have a staffed engine at headquarters, and we have a staffed engine at West Street. Now, providing neither one of them are tied up on calls and they respond to the same incident, we have 4 firefighters, and we meet that standard by putting 2 companies together, but those companies don't meet the standard separately. The problem, one of the issues that we have is the amount of simultaneous call volume that we have in town, and you've heard me talk about this before. And this was another thing that was cited in the 2022 staffing study, is they actually said in the study that the town of Auburn has an abnormally high percentage of simultaneous call volume. About 45% of the 5,300 some odd emergencies that we respond to are in that simultaneous category, which means we get a call, and then within 5 minutes we get a second call, and then we get a third call. There was a week or 2 ago where we had 7 calls going on within a 15-minute time period. We had 4 mutual aid ambulances in town, right? So this is the importance of having a supervisor that's not tied to the engine, where you have a supervisor in a shift commander vehicle that's looking at the town globally and making decisions in terms of, do we have a mutual aid ambulance going there? What mutual aid ambulance is going there, right? Somebody has to look at the big picture in order to make sure that all of the moving parts are getting done. So that's why it's critical, and depending on what our staffing is, there are some days that we have to shut down the car and that supervisor is forced to ride in an engine. And again, you kind of lose that big picture. So to the chairman's point, if both ambulances are out on a call and the car is down, we have 4 firefighters in town, 2 in the West End, 2 here, and then at headquarters. And if they're out on a call, there are times, it happens every day, where the only thing that we're able to get to you, even if it's a fire-related call, would be a fire engine and 2 firefighters. I don't love it. Frankly, I don't like it at all. We do the best we can with what we have, but I'd be thrilled if we could put consistently a 3rd firefighter on that truck. I'd be thrilled, with that. So that's why I'm really trying to kind of get over that hump to get to 12. And again, even if we're at 12, it's going to put a 3rd firefighter in the truck, a higher percentage that we're doing now, but it's still not 100%, because again, when we go to 12, our minimum is still at 9.
Still at 9?
It's still at 9 because we have to allow the 3 people, off in terms of time off. So, but right now, we're at 2.
11 and 2.
Close to, we're at 2 in a truck, close to 100% of the time. Getting to 12, it's going to increase that percentage where there's 3. So we're making strides, right? But yes, I think you're right that there is often this misconception that when you call, we're going to come, right? And that's the other thing, as the deputy just mentioned, like our ladder truck, our rescue truck, those are not staffed. Those are what's called cross-staffed. So the people that are running the ambulance also run the ladder truck, and they run the rescue truck. But if that ambulance is out, there's no ladder truck. There's no rescue truck, right? So that's why increased staffing is going to give us the ability to consistently keep the ladder staffed or consistently keep the rescue staffed. So,
Chief,
yeah.
the other way
there's-
around, if the rescue happens to be out, then there's no ambulance, you have to call in
Correct.
mutual aid
Then
for
we
an
pull in mutual aid, right. If we're at a fire call and that ambulance is in the ladder and we're out working a fire call and an ambulance comes in, then it's mutual aid that's coming in.
And mutual aid can occur even if we're having to leave Auburn because we're being needed somewhere else. So you could have two calls, technically, someone at a home because of an emergency service and a fire, or a small fire, and have available staff at the firehouse, but then a community like Oxford or something could have a need, and that you could end up tapping into that and having to go in that direction as well.
Yeah, and there are some days, right, where, and, you know, we all talk.
Mutual aid is both ways.
It's both ways, right?
Right.
And there's some days where we talk where there have been times where you actually look at what's going on in the region, and Auburn is in Oxford doing a call, Oxford's in Charlton, Charlton is in Sturbridge, Sturbridge is in here, right? There's no department would be able to survive on a daily basis without a mutual aid network, especially on the EMS side, but even on the fire side. If the town of Oxford or Charlton or Millbury, if they have a fire, we're going to that fire. If we have a fire, they're coming to our fire. You know, there's, you know, even the city of Worcester. The city of Worcester was a department that historically didn't use mutual aid. And now the city of Worcester is utilizing, you know, mutual aid. So it's a necessary evil. But yeah, I don't really know what else to say about it. We're moving somewhere, or someone is in Auburn every day.
Chief, just to clarify, that mutual aid ambulance that comes into town and provides services for a resident who has insurance, that insurance money, that resident's insurance is being paid to the community that came in to service them.
That's correct.
That money is not coming to the town of Auburn.
That's correct. It goes to the transporting service. Yep.
On that point, if we got a third ambulance, then theoretically, it would generate $1 million of revenue if we're doing 2 ambulances at $2 million. How
No.
does that, first of all, how does that affect the mutual aid with everybody else? And secondarily, because of the new building, how does the building accommodate an extra ambulance?
So we own 4 ambulances now. We're not able to staff them. So we have 2 primary ambulances that are staffed every day, and we have 2 spare ambulances. So like right now, we have 2 ambulances. We have 2 ambulances that are out of service, so we are in the 2 spares right now. So, I've said this for years. If you want to consistently staff 2 ambulances, you need 4. If you want to consistently staff 3, you need 6, right? So you need double of whatever it is that you consistently want to staff. The math is not a translation like that because these ambulances are not generating an equal amount of money, right? I would anticipate that if we were able to, and again, even if we were to go to 13, we would not be able to consistently staff a third ambulance depending on what else was going on. But with a good percentage of the time, we would be able to staff a third ambulance. I would anticipate that we would probably pick up an additional, probably $50,000 in additional revenue, and that's on the conservative side. I wouldn't want to overshoot it. But I think, when you look at the percentage of how we would be able to staff it over the course of a year, I think it could easily generate an additional $50,000 in revenue. And again, that's the business side of it, right? I would love to see a third ambulance consistently staffed because it's going to cut down on the transport time. And why I say the transport time is that we're still getting either an engine or a supervisor, so treatment is starting. But when we're waiting for that mutual aid ambulance to come in, it's a longer period of time just in the process in order to be able to get that patient packaged and start moving towards a medical facility. So yes, there's certainly a business side and a financial side to it. But but having a more consistent staffed third ambulance, and I don't even want to say more consistent, because we don't do it now. We don't staff a third ambulance now. So to even be able to staff a third ambulance a percentage of the time, that would be a good thing in the sense that we're going to be trimming out a wait time for our residents in terms of waiting for a transporting ambulance.
Any questions before we have Chief? I think it's maybe a good transition as you move into the,
Move the budget and make a motion?
I think the Chief had a little bit left of on the firefighter lines, right? Isn't it?
Yeah, so I do want to bring something to the committee's attention. So I do have, and I have told the committee this already, I have a retirement that's coming up mid-April of a member, and we have a vacant position because a member did not meet their training requirements, so they're no longer with the department. So come mid-April, I'm going to have 2 vacancies. We were fortunate enough, we advertised the positions. We were very, very lucky. We're very excited that we're going to be able to pick up 2 members who are currently working as full-time firefighters. They're both academy trained from the town of Charlton, and they have both accepted tentative offers. They're going through the medical physical process. So I have an anticipated start date of those members on April 28th. The issue that I have is with the member that is retiring, they're going to have a payout of paid time off and things like that. So when I look at what I have for the balance in the firefighter salary line, it's not enough money to bring those 2 members on April 28th and make to the end of June 30th.
When did you learn about the retirement?
I reported that over a month ago.
You've only known for a month the budget
Yeah.
was in
Oh, yeah.
place. So wouldn't we just do a transfer from the salary reserve for their retirement and then just leave the budget intact?
I guess it's an option. I have another solution that I will pitch to the Finance Committee, and the Finance Committee can weigh that out in terms of how they want to do it. At the end of the day,
You're going to write out a personal check? Just an idea.
It's an idea. It's an idea. So I need $18,254 on top of the $5,000 that I have in the firefighter salary line now. So we have, right now, I have $27,000 remaining in my training line. And the reason that that has been untouched this fiscal year is I've been working off of a funding source from ARPA for my training for over the past 2 years. So if you look at the past 2 years of my training budget, it really hasn't been spent down until kind of later in the year, or if it's even spent down at all. It's not that training is not getting done, it's that for the last 2 years, I've had an ARPA funding source for training. So I have $27,000 in the training account, which is the budgeted amount. If I take $18,000 from that to move to firefighter salary, that leaves me a balance of about $6,000 in training, on top of the remaining $15,000 that I have in ARPA between now and June 30th. That amount of money between ARPA and the balance in training will cover all of my training obligations between now and June 30th. So that is an option, but if that's something that the Finance Committee is not comfortable with, we can certainly talk about something else, but I was trying to capture it within our operating budget. And the reason why I want to do this and why I'm shooting for April 28th is because these are 2 seasoned firefighters, their training time is going to be less than the normal person. And I really want to try to put us in a position where they are cleared to operate independently on July 1. That way, on July 1, I'm already not starting behind the 8 ball in terms of people that are not cleared to operate. So that's why I'm looking to make this move to bring, these people on, so I'm not short between, and the deputy and I talked about it. We talked about the potential of not filling the position between now and June 30th to try to save the money. And when we ran the number on what the potential overtime was going to be to cover that, it doesn't make any sense, especially where the 2 members that we were able to get, we're going to be able to get these folks up to snuff fairly quickly. So I think it makes sense to make this move, so on July 1, we're sort of like, we're ready to go in a new fiscal year. So so my plan is, if that is the route that we're going to go, my plan was to bring a transfer before the Finance Committee next week. I have the transfer here now. I do know, I spoke to the CFO about it. I know that the Finance Committee does like to see these ahead of time. I do have the transfer prepared tonight, but I am also not opposed to coming back next week to do the transfer if that is what the Finance Committee.
I think we should probably just wait till next week.
Next week, when we have to, it's not on the
It's
agenda.
not on the agenda, so I think,
Yep,
I like your plan. Yeah, it beats right now to check.
yeah,
So, yeah.
it does.
Then.
Chief, anything else you want to?
No, so I think, just the last couple, it's fairly straightforward. Equipment repair and service, that doesn't include fleet, that's all service-related stuff. It's the flow testing of our SCBA and ground ladders, aerial testing, pump testing, all that stuff. Medical director salary, protective gear, clothing and uniform, which is contractual. That's about it. I just wanted to give an update. The last couple of slides is I just wanted to give an update to the committee without getting into too much detail. And the committee has, and the reason that I bring this up is because the committee has mentioned in the past, when you look at CIP, that it appears that there's items that were funded 3 years ago or 4 years ago, and the money hasn't moved, and you wonder what's going on with those projects, right? So our radio project is an example of that. This project has been going on for 4 years, and a lot of that is, again, you got to think of the time frame, right? When we started this project, we were essentially, this was approved right on the heels of COVID. So we had a hard time getting equipment. It took, in some cases, 16 to 18 months just to get the equipment that we ordered. So this has taken a long time to get this project going. So right now, we are operating with our new 3-site simulcast system, which has improved our radio transmissions greatly. Part of that radio project also included a station alerting system, which again improved the internal communications in the station greatly. We can actually hear what the call is. It's amazing. But again, when we talk about technology and those technology upgrades, right now we have what's called station boards in the station. So when a call comes in, it's an automated voice that tells us where we're going. The call appears on a station board. It has mapping. It shows a Google Street View of where we're going. If it's a fire-related call, it shows the hydrants on the particular street in those locations. We have mobile data terminals in all of our vehicles. So all of the call information is displayed on the MDT. Vehicles are all tracked with GPS, so we know where the fleet is at all times, and that makes things very simple for the communications center if both ambulances are out and a call for a third call would come in for an ambulance, instead of the old way of getting on the radio and saying, A1, has anybody heard from A1? Have they cleared from the hospital? They can simply just look at the screen and they can figure out whether or not the ambulance is still at the hospital, and they're able to respond. So the efficiency has improved greatly. So I just wanted to give the committee an update that our radio project, it's been a long time, but I'm hoping we're going to be able to close this project out in calendar year 2025. It's been a long time coming, but we're really enjoying the improvements from an operational perspective. It's been outstanding.
Chief, we'll flip to the CIP just quick. That radio project, where is that listed? Is that under?
Probably 2020.
Okay.
It was probably either fiscal 19 or 20.
Yeah, so we're start at 25, so it doesn't, I don't think it's on our calendar, on our schedule, or it's hard to tell.
I want to say that first hit the CIP back in fiscal 20. It was just after COVID when it was probably fiscal 21 that we started making our first purchases through that.
So wouldn't it be under the fiscal year 25 column? if we're still paying for it in this year?
We have, the money is sitting as an appropriation in, I want to say FY '21, and we've actually expended
Oh,
very
then
little
it's
money.
not on our CIP budget.
Correct.
right?
It's a previous
It's a previous,
CIP
okay.
expense. But
Yeah.
it's an example of, and I think, Mr. Jones, I think I've heard you bring this up. It's just an example when you look at fiscal '21, and there's $300,000 sitting in a line, and you
Well, that's
say,
going to be one of my questions, but when we get through
Right.
it, yeah.
you know, it's like, well, what is this money doing? This project is an example of that.
Sure, okay.
In terms of my FY '26 capital, it's the replacement of a fleet service.
Can we hold that and do the?
Do you want to do the regular budget?
Do the budget, just vote on that? and- Thank you, sorry, I
Yep,
just,
no problem.
Any other questions for the fire chief on the regular FY '26 budget?
I'm going to make a motion to recommend.
Okay, we have a motion to recommend. There's a motion and a second to recommend the fire rescue budget, fire total being for the town manager's recommendation, $5,583,151. Motion and a second relative to that amount. All in favor?
Aye.
And
Chair votes yes?
chair votes yes. I do. My hand was up with everybody else's.
I didn't see it.
I'll raise it higher next time.
Now, so we can
Have to
talk
have them call that.
CIP till midnight, right?
Right. Okay, so the CIP. Chief, did you want to?
Sure, so we only have two items on the FY '26 CIP. It's the replacement of the fleet service truck. So right now, the fleet mechanic is operating out of a pickup truck, and it's kind of convoluted, especially when he's doing service calls on the street. If something breaks down on the road, he's got to, put toolboxes, and he's got to load tools into the back of a pickup truck. So a utility body truck is going to be more appropriate for that, where he'd be able to leave tools in the vehicle all the time. This will have an onboard air compressor. It'll have a transfer tank for diesel fuel, so he's able to fill vehicles at long-duration incidents. So this will be set up as a true fleet service truck instead of having to operate out of a pickup truck. Again, as noted on this point, these are not the actual vehicles. It's an example of what will be purchased. And the white one, where it shows the lift gate, it's what's called a Tommy gate. This vehicle will have a Tommy gate, because again, a lot of the stuff that he's putting in the back of the truck, it's very heavy. You're talking about, tires for fire engines that, they can't be lifted. So to be able to roll them on a gate, to be able to get them into the back of the truck and things like that.
There's only one vehicle on that, too.
It's one vehicle. I just wanted to show what the gate was and what the utility body was.
The 5-year lease on the schedule, if I'm looking at the right line, I take it this lease, includes interest.
It does.
Okay, that's what I wanted to, and the $400,000, oh, there was a second one, you said, that was the first one, the truck, what was the other one?
The replacement of the rescue tools for $90,000.
No, which is on here, I'm just trying to find it on the schedule. Yeah, right up here. So it's, because, it's in 26 and 26 revived, thank you. Okay. What's throwing me off, and I know you said you're dealing with some of the things we've talked about in the last couple of years have been delays in the equipment that you've needed because of COVID and a lot of issues. You have 2 ambulances that are spare and 2 that you're using, and there's a $400,000 line sitting in the ambulance for fiscal year '25, and I was just looking for clarification on that.
So,
Are we replacing one of the ambulances?
yes, so we currently have 2 ambulances. So the lead time on trucks, actually, I'm going to let the deputy speak to this, because he
Yep.
handles all of the ordering of ambulances.
So we currently have 2 ambulances on order. It's just under $1 million for them. 3 years from the time you order an ambulance before you see it. So we planned out accordingly. As long as it fell in the 5-year CIP, we were able to order the ambulances to try to get them to arrive at the appropriate time to replace it based on our replacement schedule.
So this $400,000 is the first one to be replaced, and then in fiscal year '27, we'll go and replace another one. And they're already ordered, it's just that these are the years that we're incurring the expense?
Correct. So the two ambulances that we've had on order right now for a year,
Right.
we will not see those trucks until calendar year 2027. But they're programmed in here, and we used to be able to order an ambulance, and we'd have an ambulance in 7 months.
Well, that's why I'm bringing it up
Yeah,
on,
so it was a little easier when you looked at it. It was like, oh, okay, we ordered it, and then we're going to pay for it the following year. Now it sort of has the appearance that we're ordering an ambulance every year, which in some cases may be, but we're ordering one every year in order to get it 3 or 4 years later. So we're trying to do our best to project out what year do we need it, and then order it 4 years before that. Fire engines are 4 years, and ladder trucks are 5 in terms of wait time.
Chief, do you see that changing, or is that just the new standard of where it is?
So I don't see it changing in the immediate. I can tell you that one of the other things that was brought up in Washington and is the fire truck market right now has become a conglomerate, which it never was that way before. There was a lot more independent shops where you could buy places. Right now, one particular marketing group owns all the major players. Fire Chiefs Association of Massachusetts has asked our state attorney general to look into the issue and file a lawsuit against that conglomerate because we believe that they are cornering the market. They are what is driving the prices up on these vehicles, and they are what is creating the wait time. I can tell you that Senator Warren is looking at the same thing on the federal level because, again, this is a national issue. When you have one company, one holding group that holds the power on all of the 6 or 7 major manufacturers of fire apparatus, that is why the inflation on those trucks is out of control, and that's why the wait time is out of control. So we have encouraged our state attorney general to potentially file a lawsuit. That's the only way I see it changing. Outside of that, I think they really just, they have everybody at this point. So unless there's some legal action, I don't see it changing.
Public company or private equity?
It's a private equity company.
Any other questions on the CIP?
I thank the committee's time. It's always great to see you.
Thanks, Chief.
Thank you, Chief.
Thank you.
Emergency management, number 291 is up next.
I don't think they have a CIP either.
CFO, is there anything you wanted to present on this one? I know the, Mr. Otterson, I don't believe is going to be, did you want to?
I can answer any questions. The emergency management budget, for the most part, is made up of stipends. There's some small equipment items for the CERT team, and then there's a portion, a good portion of that is for generator maintenance. So there's a total of 13 generators in the town that power the buildings. These are the large building generators. And the preventative maintenance, which is done by our fleet mechanic, the money for the preventative maintenance and repairs falls under the emergency management budget. So that's essentially the 3 main components of the EM budget is generator maintenance, the stipends, and then a small equipment line.
Any questions on this one? Sounds like it's largely managed by, I think we heard from planning as a component of it. Fire and police have a component of the true, but it's, yeah.
Motion to recommend.
I have a motion to recommend.
Second.
And a second. And the motion to recommend and a second of the $17,500 town manager recommended budget for the emergency management department. All in favor? Aye. Sure you got it, Patrick. Okay. Police department, 210. Chief Lemon and Deputy Chief Mills.
Good evening, Mr. Chairman, members of the Finance Committee.
So I guess to begin, I'm going to start out with glass half full. I'm pleased to report to the board that for the first time, I've been on Auburn for more than 30 years, and for the first time during my career in more than 25 years, we're fully staffed. And that didn't happen by accident. That's been through the support of the Board of Selectmen, that's been through the support of the Finance Committee, listening to the needs of our public safety people. We're currently staffed and budgeted for 44 people. We have 3 student officers recruits that are attending the Worcester Police Academy right now. And for your edification, we went through 300 names on the civil service test, more than 300 names, to get to the 3 student officers that we have selected. Civil service has become very complicated to deal with. There's been a trend across the Commonwealth of communities that are separating themselves from civil service. Worcester most recently did it with their police chief's position. But I digress. We're pleased to have that happen. Couple of highlights over this past year as it pertains to the budget. We were able to add an additional student SRO, school resource officer. We added an additional person to our traffic unit, so we now have a daytime traffic, full-time devoted traffic officer. We have an afternoon traffic officer, and that has been consistently the most requested issue of the police department. We're contacted on a weekly, daily basis. Citizens request traffic enforcement. That is a quality of life issue for us citizens here in town and other communities, and we have listened and done that. So with the additional SRO and the detective in the traffic unit, that has been functioning wonderfully. Separate from our budget, but umbrellaed in our budget, is communications. I'm happy to report we're almost fully staffed. I had gone before the Finance Committee in the past to ask for 2 extra positions to alleviate some of the stress and the pressure that our communications professionals deal with. So we're in good shape in there. Over this past year, we realized 29,378 calls for service. Now, that's combined, those are the calls that come into our communications center within the police department that include fire, police, and EMS calls, which realized about an 1,800 call for service increase over the previous year. We realized 308 arrests last year, 273 warrant arrests, and 450 crash reports. Probably, and I won't bore you with statistics, but the statistic that I'm most proud of, because of our operational directives, is that our crashes are down 30% last year, which is pretty significant. Not a lot of communities can say that. We focused a lot of our efforts on our intersections and our roadways where we have most of our crashes, and again, I'm very proud to say that. So this year's budget,
I don't mean to interrupt, Chief. I'm concerned that I don't have the right budget in my book. If you look at this 25 appropriation, I don't know if my titles are wrong.
See the 26th, too?
I don't see.
That's the admin total?
20, well, I just have
And
what
then
was
the
appropriate.
second page is the
Or
overall
it
total?
says 25 appropriate. Nope, I think we're good.
Yeah, we're good.
I think
We're
we're
good?
good. So it should end at 5.3 million. I know we're going to go over it. Okay, okay. It just, you know what it is? It looks different than some of the other templates, so I got caught up in the wrong column. So I
because I
apologize.
had a little slight panic attack.
No, well, I did too, because it looks so different. So I apologize. Yeah, exactly.
So some of the bullet points, Mr. Chairman and members of the committee, that to get to the nuts and bolts of the budget, and Chief Coleman spoke about it how it affects the fire department. So this year's budget is going to reflect the chief and deputy at a 2% base, 2% increase based on contract, okay? All the groups were level funded for their salary lines. Deputy chief, when preparing the budget this year, he included the expected step raise in the current budget, but because we're in contract negotiations, that has not been budgeted for. This year, last year, we added a third lieutenant. For the members of the Finance Committee that weren't here, we had always operated with a day shift and an afternoon shift lieutenant. They had various administrative responsibilities. Wanting to get my supervisors, because of the nature of high liability with our line of work, we wanted more supervision on the roadways. We wanted our sergeants to be on the roads with the patrol officers for more supervisory oversight on the calls. So we were funded by town meeting, Finance Committee members, and the Board of Selectmen supported a third lieutenant, which we refer to as a watch commander. So now we have a lieutenant that operates on each shift with a significant amount of administrative responsibilities that the three of them have. When it was implemented last year, it was only funded for a half a year. So the budget will reflect this year the full funding for that particular lieutenant that was voted on by town meeting. This year, my largest ask has been to add a 45th police officer to the department. I have had to, as I explained earlier, I have taken away from operations in essence, and I don't see that as a negative, to add into the school resource officers, the additional detective, and the traffic unit, all of which have revealed positive results. But because we removed those three, we have not changed our staffing levels in years, which is what our minimum staffing is, and currently has been for the past almost 20 years. Minimum staffing has been a supervisor and 3 patrolmen. Okay, and that's bare bones minimum. Now, I don't want you to think that during the day or sometimes during the afternoon that that's all the resources that we have, because it's not. We have a vast amount of administrative personnel, whether it be the lieutenants that are in the building, the detectives that are working during the day, the school resource officers that may be at 2 different schools at the same time. So we have a lot of resources that we can pull from besides that minimum staffing, but that's essentially where we've been. When I went over this with the town manager and Mr. Kasanovich, he supported the idea and said that, suggested funding it for a half a year as he did the lieutenant's position, which he did last year. With regards to increases in the budget, I'm going to let Deputy Chief Mills, who deals with my budget on a daily basis, go over the minutia of that.
Thanks, Chief. Essentially, excuse me, the largest increases are in technology support, from $70,000 to $100,000. That's based on what the reality of what the costs are, month to month. With the CFO's assistance, we're looking into switching from a co-managed model to a more fully managed model. It would be an increase initially, but I think in the long run, it would probably pay off and be best for us, because as of right now, we have a patrol officer who's a court resource or a court liaison person who also does IT for us, and he's a patrol officer, and he's not always there. So the co-managed model worked for a good period of time, but now, as both the fire chief and the police chief said, the amount of technology that that we're all reliant upon requires kind of full-time attention. So that's one of the main increases, is from the $70,000 to $100,000. We had slight increases to equipment repair, body cam storage. Body camera storage is based on a contractual obligation that we have because we installed 2 cruiser cameras in the traffic unit vehicles. And health and wellness is up $2,000, as well as dues up $1,700. We use health and wellness to fund new hire requirements, physicals and psychological testing, as well as the professional associations. It seems like every one of them has gone up, whether it's the CEMLEC, the Central Massachusetts Law Enforcement Council, International Association of Chiefs of Police, Mass Chiefs, Central Mass Chiefs, they all have increased. And any other modest or small increases within the lines are based on the addition of that 45th person and their eligibility for health and wellness, for the health and wellness stipends, which, as the chief alluded to, all of those are subject to further contract negotiations, and, they're at the table now working through some of those things. But as the chief said, all of the, all of the patrol officer, all the salaries were based, especially patrol officers, they're based on what step they would go to during this upcoming fiscal year, but we don't know. We're not able to capture what the value of those steps are or may change, what the changes may be in those steps. So they may increase again, and that'll, hopefully be accounted for with either wage reserve or, any future appropriation at, whether it's at the May town meeting or possibly in the fall, depending on the results of the contracts.
Questions for the chief and deputy chief?
Sure, I'm anxious to ask you while we have you. I know 911 has been, you were struggling with staffing and the calls and how that's, if you could just update us on how that's going.
Sure.
Still difficult?
It's difficult, and we're not the only community. So right now, we are part of a much larger, the town of Auburn is part of a study, once again, for regionalized dispatch. And we jumped on board with a grant. It didn't cost the town any money. We jumped on board with a grant that was sought by the Spencer, town of Spencer, I believe. And Spencer, Southbridge, Sturbridge, and Charlton were part of them. Now, added into the mix over the past month, Rutland Regional, who is already an established regional dispatch center, is they're looking to possibly relocate, maybe add other communities to it, and already up and running regional communication center. I can't tell you as I sit here whether or not that's going to be a good fit for the town of Auburn. Chief Coleman and I, we agree on a lot of things. We decided to look at this globally, as Steve would say. We decided to look at it. I know that I can't run my building dark like some communities do, meaning I can't shut the doors during the day, so I am going to have, even if we lost every dispatcher, they walked out the door and they worked for a regional dispatch center to cover the town of Auburn, I still have a level of customer service that I have to give with people that are coming in with lobby calls, with complaints, with emergencies that just show up on our doorstep and whatnot. So there is going to be a financial cost to that, as is there going to be a financial cost to the communities if they do decide to buy
Well,
in.
there's an opportunity cost. You're exactly right. You give up something, you're going to give up. It works both ways, and I think you stated it really well when you said that you don't want to run your business dark. So
Correct.
I think that requires a lot, especially volume and then the whole dynamic of it. How is it going to work? How is it going to fit in? If you're, and what was the area you said that was regional?
Rutland Regional.
Rutland's a good distance away from us.
It is.
So how is that going to work for us?
It is. So we've decided, Mr. Jones, we've decided to keep an open mind about it.
Okay.
We want to see what they have to say.
Yeah.
They're a very well-run, very organized company that's done many of these studies across the country and actually, I believe, different parts of the world. And we're waiting to see what they have to say, and at some point, there'll be a presentation. So that's essentially where we're at now. We ebb and flow in communications. I can honestly tell you, and I've said this before, and I don't mind saying this publicly, the communications professionals, not here and afar, I believe, are underpaid for what they do. The day that I started, when I started back in the late 80s, early 90s, sitting at a typewriter in the Charlton Town Hall, answering 911 calls for the town, I had a typewriter that I one-fingered typed. It's way beyond that now. There's mapping, there's...
Oh, once that phone rings, you're on. You've got so many tasks that you have to do. It's not even, you're right, I'm sure they are underpaid.
It's a lot, and I think it's a travesty that they aren't considered, at least in this state, first responders. They should be. They do God's work there, and they work very hard. It's a very challenging job, and it's not a job for everyone. We've spent thousands of dollars bringing these young men and women on board and going through the hiring process, training them, only to find out they're there a month and they say, yeah, this isn't for me, it's not going to work out. So hopefully, moving forward in public safety, our professionals in our communities and our cities will recognize this. I know that the city of Worcester were bleeding people in their communication center because of the call volume, and they made major contractual changes with whether it was financial or even scheduling changes. So without giving up what's going on in current negotiations, we're looking at all options to make it a better work environment for the individuals that were in there. We just released someone within the past week that we had hoped was going to work out, but that person didn't, and we're basically constantly going through the hiring process. But I will tell the board, your support financially with getting those 2 other impact shift positions has made a tremendous difference, because even though we weren't able to fill those positions right away, we had part-time dispatchers and police officers that currently work for us that before they were police officers, they were certified 911 call takers that kept their certifications that would fill in and take part in some of these shifts. I don't know if anybody in this room noticed, but there was a significant presence of Auburn police officers on Route 20 today, to the point where I received several calls wanting to know what was going on, because that's usually what happens when my wife gets to work or whatever it may be. But we were part of the Highway 20 initiative that focuses on traffic safety and traffic enforcement on Route 20 from here to Oregon. And state and local police agencies do that. And because of that, because the call volume is so significant, we actually had a 3rd dispatcher that was on today to help with the call volume. So I don't know if that answers your question, Mr. Jones, but that's where we're trying to stay focused.
The calls are still up, though.
Yes.
Yeah, the volume is up, which is, Chief Coleman alluded to. The technology line, just to clarify, do you have a single individual that's your technology, or do you have multiple people and some of them are patrol?
So at the police department, we have 1 police officer who works Monday through Friday.
It's actually a police officer.
So we have a company, Global Data Systems. They started off small in Pembroke, and now they're all over the place. And they've grown considerably, and we've had at least a 14, I think, year, thereabouts, relationship with them. And their costs go up, annually. And in the past, Mr. Marshall said, we should really look into more of a contractual kind of situation with them. I think they've been resistant to that in the past, so I think, through the CFO, that we've looked into changing the model as far as how we're using those services, and maybe the co-managed thing is probably not working as well, because what ends up happening is we're getting ticket or invoices basically for things that are happening out of the coverage times, and the coverage times aren't what they should be as far as, we're a 24/7 business, so, So that becomes the major issue. And, when there is a problem, and some of them unfortunately are unforeseen, and when those invoices are generated, you don't have a choice, but on the low end, it's $3,000 a month and sometimes over $5,000 a month. So there are some fluctuations, and we try to, average it and budget it realistically.
That's all I have.
Sorry, I think I missed this. What was the call increase volume, the percentage you said? I missed that.
The previous year, they were up 1,800 calls. And Mr. Jones alluded to it as well. The calls of, the policing calls that we go to now have vastly changed, meaning years ago, we'd go call to call. A lot of the calls didn't warrant reports. It's different now. We're on scene much longer. Almost every call warrants a report. There's ancillary services, whether it be a mental health issue or whatnot, and we can't just go to the call and clear it. So the operational stresses on the day-to-day officers that are going to these calls, there's a lot for them to do. So they've definitely morphed over the years to be much more time-consuming.
The dispatch is full-time or fully staffed. It's 2 people, and they're handling the window as well. Is that correct?
So right now, we're funded for 11 full-time dispatches. We're funded for 11. So essentially we'd run 2 days, 2 afternoons, 2 nights, and then the impact shifts that the Finance Committee and the Board of Selectmen funded us for a couple of years ago covered 7P to 3A and 3A to 7P. And, did I get that right? No, 11A, thank you, 11A to 7P and 7P to 3 o'clock in the morning. And the benefit that we realized by that was A, additional coverage to assist the dispatchers, and B, if somebody booked off sick or had a vacation day, we wouldn't have to call in overtime. And if we did have to call in overtime, generally it would be for 4 hours rather than 8.
Didn't you have an overlap, though, between 3 and 7 at one point? Or is that already included in these times?
When we're fully staffed at 11, there is that overlap.
So it really goes 11 a.m. to 3 a.m., and then there's an overlap that goes inside there.
That you could potentially have up to
Well, yeah.
3, but if you lose one for leave time or
Right,
sick
right.
time, then you can go down to the
But
minimum.
there is an overlap.
Yes.
There's an overlap in the formula. It doesn't necessarily always play out that way.
Luckily enough as far as it pertains to the communications section, their overtime hasn't been outrageous this year, but a lot of it's offset by state grants. There's 911 grants, both for training and for support and incentive, what they call the support and incentive grant, and that basically relieves us of almost $67,000, for the support and incentive, $67,000 worth of overtime, occasionally used for equipment, but the bulk of it is used for overtime replacement. So once the grant becomes active, we kind of hit pause on the overtime, at least in the dispatch center. As the chief alluded to, the police officers that are actually working shifts in there to fill in, we pay them out of our operational overtime budget. So,
Additional questions? My question is relative to the 45th position. That's fully could you explain that one again?
the 45th position, we asked obviously for a full year, and it ended up negotiated down to a half-year body. So they'll start in January, and it's all well and good that we have 3 student officers in the academy right now, and we're talking about adding another person in January of start date of January 26. And lately, we've been sending our officers to the Worcester Police Academy, and they seem to be running on a January to June. It takes about 6 months. So January to June, they're in the academy. They get out of the academy, they do 3 months. And from what I'm hearing, there's a motion or so afoot to increase field training from 3 months to 20 weeks. I think they want to either 18 or 20 weeks, which really puts more of a burden on things as far as getting those officers on the road, because even though they're on payroll and we're paying them from January all the way through, they don't help us on the schedule, best case scenario, till October 1st. So you're in that cycle of it's, and we can't complain, it is what it is, but it's, as far as sitting here right now, we anticipate potentially 3 retirements in FY26. So before January. So we're going to have those positions where, if they're at the command staff level, one or more of them, then you're going to have to move a patrol officer up into the, promotionally, and now you're going to have a gap at the patrol level, down on that level, and you're going to be working to get a person in the academy and fill that, and you're from the minute you hire them and start them, it's 9 months. Just, obviously there's training required, and that's the way it goes, but it's not just plug and play. Unfortunately, we try to get transfers when we can, as many as possible, but lately not many people seem to be wanting to move and uproot and go to, the chief and I both came from other communities, but initially, but it's less prevalent now, it seems, so.
Chief, Deputy Chief, my question relative to the position is, this year's going to be a tight year.
Meaning 26, or?
26 is going to be a tight fiscal year, we anticipate. We have the unknown of the collective bargaining agreements, so there's a lot of uncertainty. I guess I will leave it at that. So, but the fact that it's not starting potentially till January, is that correct, for the next academy?
That's correct.
If something were to, the collective bargaining is done and we see that we have to make, it's not like this person's starting tomorrow and we'd have to be looking to let them go because of shortages.
Right.
So that alleviates that part. But you also mentioned 3 potential retirements, and of what ranks are those, are any of those supervisors, potentially?
At least 2, yes.
So that leads to my question of, do you have existing assessments that you're able to tap into?
We have active lists for all.
You
We have active lists for all
So
positions.
you wouldn't be looking for monies for additional
No.
assessments within?
No, we ran through that fire drill 4 years ago that the Finance Committee was part of, and I would not let that happen, that we are not going to let that happen. We made sure we went through the assessment process for all ranks, and when people decide to depart, we can put those people in place, and I won't be coming to the committee or the fire chief to write a check for us, so.
I just want to make an observation, because it came up earlier when we were talking with the fire, and I just want to remind the board that one of the reasons why it's important when we recognize the need for staff is because, and to your point, Steve, when we hire someone and we're working on an operating budget, those dollars that go to hire someone spill out into many other areas of the budget. And what I mean by that is we see their payroll here, but their benefits go up. So when you see the insurance line items and you see various things going on in HR, those lift those expenses. When you look at the retirement that we're obligated to meet for those people that stay, whether they're fully in our community, come from another, we have to contribute to that. And then when they retire, and then, with OPEB, the demand, it's no secret that as you bring staff on, and we want to bring staff on, we want our departments to work, and I think that some of these conversations we've had for almost a decade, in all fairness, and we're talking a person here or there. But since our chair mentioned it, I just wanted to take a minute and mention that it's not just the line item here that you're looking at. You have to sort of connect that payroll to many other areas of the budget. And that's why it's really important when I brought up the reserve fund, and you want to make sure, because when you're in a contract year and those negotiations go through, you have, as part of the contractual agreement for some of these positions, you have to fund them whole then. So and in some municipalities, sometimes that funding doesn't happen because there's issues with the negotiations, and we could see ourselves back at the table next June saying, well, we put this much money aside in fiscal year 26 for those, or 25 and 26 for those negotiations. You still have to pay those. And then 27 will come up, and we'll have to then add to that because we have a responsibility to make that whole. So I just wanted to, while I had a minute and we were mentioning it, and with the school and the library and the DDI, the other departments, the DDIS and the DPW, so many of these large departments, we want them to be well-oiled and operate, and it's a task and a half for you gentlemen to operate a police force. But I just wanted to reiterate that the budget is, to come before us for a request for a new person isn't taken lightly, and I don't want to shoot it down, but it is an extravagant expense once you've added it to the roster of people, because it exponentially increases many areas of the budget. So, thanks.
I guess my question relative to on the same vein is more to the CFO. So if we recommend this tonight and agree with all the good work that the police department's doing, but things change, in the economy and what the contracts end up being settled at, are there discussions behind the scenes with department heads relative to positions go vacant, even though it was funded here, recommended here tonight? Or do those discussions happen, well, because of X, Y, and Z has occurred since that recommendations, while you've got an open position, we're not going to fill that position at this time, or we're going to make some other adjustments internally, just for the taxpayers in general, for discussion purposes here?
I do believe that would always be on the table, that, and I think that we've discussed that in the past as well. Sometimes we anticipate bringing on the new employees at a certain time or promotions at a certain time. Sometimes we've pushed that forward in order to adjust within the department. So yes, that would be considered if we had to go that route. Hopefully we wouldn't, but.
Right. And just one more question relative to body cam storage. You mentioned you've got 2 cruisers now with the cruiser-mounted cameras. Is that what's reflected here, or is this storage costs for
Excuse me, the 2,500, I think it only went up to, well, it went up basically essentially $2,500. The body cam, the actual body cam cloud storage has it changes year by year. I think I want to say it's either $36,000 or $37,000 in this coming up obligation year, and then for the two cruiser cameras, it adds another, I think they're $1,250 or $1,225 apiece per year, as far as an obligation going forward.
So that's, do we have a contract with Motorola based on the amount of evidence, or is there a flat?
It's per camera. Excuse me, body cameras are approximately, it's $895, I want to say, dollars per year. And it's not dependent on how much video you upload. So the chief and I don't put a ton of video on the cloud, but we're still paying the same number of
Same rate as the
storage.
most active patrolman that's out there?
Correct.
Same amount of.
Yeah, it's,
And on that, has there been any discussion, Chief, through Mass Chiefs relative to a funding source from EOPS or from the state relative to providing like a statewide contract where evidence storage and things of that nature are done statewide? I think Rhode Island has done something similar to that, where they have a statewide.
There's been nothing. Unfortunately, at the last General Chiefs meeting that we had in Sutton a couple of weeks ago, they're talking about, it's not really all good news, but they're talking about raising the academy cost. They're talking about doubling the cost for the communities to send student recruits to the academy. But there's been nothing on body worn camera. They wanted it. The Commonwealth and across the country, they wanted us to have body worns and show transparency and all that, and we've met that obligation. We went online last June, and so far the program's been great. Especially my younger officers really embrace the body worn cameras and the footage. They feel that they're protected because of it. And just to comment on Mr. Jones, through the chair, I'd just like to reassure the board that I'd be remiss if I didn't tell the board, and I can say this, I've been on a long time, I recognize how much the board and the various boards, but most especially the Finance Committee, has supported the police department and public safety overall. I get it, you guys have. I want to also assure the board that it's been our goal to be fiscally responsible, financially responsible. We watch our dollars. We try not to overspend. I tell my supervisors, if it's an emergency or whatnot, and you need people on the road, you get them, because the boards have always supported me in the past. We had an incident that happened a couple of weeks ago on a Saturday night at 2 o'clock in the morning. I'm not going to sensationalize it, but it was a shooting, multiple rounds. We had a person that was shot. There'll be a social media release on it later tonight. We had mutual aid from not only the state police, but from all of our surrounding communities. We didn't have the personnel. So I guess the point that I'm trying to make is I understand with the fiscal situation that's going on, not only just in this state, but across the country with the homeless and the migrants and the housing and so on and so forth, that everybody's kind of looking with wide eyes, wondering what's going to happen. I would not be before this board asking for a person if I didn't believe we truly needed it. And I just wanted to tell the board that face to face.
And I just wanted to respond that I think it was a timing issue that I brought it up. It wasn't directed at the police department. The fire had already presented, and we have the school committee coming in and several other large boards. So by no means was I implying or thinking otherwise. I just mentioned it because there's a lot of large departments coming in, and if you had come up first, which I don't know why you didn't, because your budget's before the fire department, but we can't do anything about that.
I think we went first
But if you had
last year.
come up
We
first.
went first last year, so.
I probably would have not mentioned it until the fire department had come up, if they had come up second. So it was a timing thing. It wasn't meant to imply anything other than that.
I understand that, Mr. Jones, and that's why I wanted to tell you, I fully recognize how supportive you and the other board members have been over the years, and And again, I just wanted to drive the point home that if I didn't truly believe that we needed another police officer's position on the road in the interest of public safety and the safety for the citizens of the town and the safety of the officers that are working on the road day to day, I wouldn't have asked for it.
And I do have one other question, because I'm laughing because I probably never asked it, and I probably know the answer, so that's not a good sign. But why isn't there gas for your patrol cars on your budget? Why am I missing that?
It's in the town budget.
It's in the town
The town
budget.
covers,
The town covers your gas.
And utilities and
So all of your fleet has gas cards.
we,
Two
we have gas cards up at the Shell station, Route 20 Shell.
Right, okay.
Basically fill up and sign a couple of different documents up there.
It's on the town side, thank
they're
you.
all gas vehicles. There's we have two hybrid cruisers. There was recently actually just some information shared from the town level about some of with the green communities and all that, and I became kind of concerned because there's no viable police
Because we're watching that.
operational options, and as it turns out, we were not going to be exempted as of July 1st, 2025, but then I sought some clarification, and turns out that because there are no viable alternatives, with the exception of administrative vehicles for actual police operational vehicles, we're going to be able to continue to, and, we're going to be responsible and seek out the best mileage and whatnot, as well as the best prices. And that's what we've generally tried to do, is the vehicles we buy are usually on the lower end, or the lower of the two choices for police vehicles, so.
I just want to add one additional thing, and I don't think either the fire chief or yourself brought it up. It's not a truly popular thing in town at the moment, but we have some increasing housing units coming online this year and through the future, which could reflect in an increased number of calls for service. Is that an accurate consideration?
So that's a great question. As much as I'd like to tell the board that it was going to be a major influx and I could use 15 more police officers because of it, that's certainly not the case. So Chief Coleman and I, we talked about it, we ran some numbers, and what we did was we ran some numbers with the 40B project that's in West Auburn, where the two buildings that are currently built. There's what, 5 more going up?
Yeah, there's 5 operational right now, and there's 7 more that will be total.
7 more that are going up. So we looked at it, and our call volume definitely increased because of it, but not to the degree of the fire department. We've had miscellaneous calls. We had a suicide there once, but for the most part, it was, it was minor domestic issues and whatnot, but it was not a massive increase. I don't know what's going to happen, because we did run some numbers that I got some numbers from the town manager that if all these 40B projects come to fruition and are fully occupied, we're looking at approximately a 10% increase in population in the town of Auburn. How that's going to affect the schools, the police, the fire, and whatnot, I'm sure is a much larger issue. But as far as we're concerned at this point, we've not seen a giant increase. I was surprised to see the call volume that increased for the fire department was much more significant.
I have a kind of a mechanical question about how the state runs this whole thing. So when we send somebody to the police academy or to the fire academy, we're actually hiring them. We're paying them while they're in school. And are we paying for the training as well, or does the state provide that for free?
Yeah, we pay the current academy costs are $3,200 per student. That's just for the tuition. And then we have to equip them. And then obviously we pay them at what is currently what we call step 1, the first step of the contract. And they remain at that step for 18 months. So the full year. And their conditional offer of employment is based on successful completion of that academy training program and field training. And
Coming through a particular town, like you don't apply to the police academy as a wildcat and then decide who to work for later.
because
So
of the
that's,
civil service.
that's actually, it's a
yeah.
great question, because some towns, so the way the academies work, and it's different from the fire academies, but the way the police academies work, individuals that don't have a a job can get sponsored through different police departments. We've done it from time to time over the years, but not a lot. And I believe the fire academies, they don't go through the academy unless they have a physical job in a community, in their city or a community. So, but rarely does that happen. So we go through the process, which is very lengthy and time-consuming. We give them their conditional offers. They make their way through their backgrounds, their physicals, their psychologicals, their medicals, all of which is a pretty significant cost to the town. And then they get into the academy, and God willing, they make it through without getting injured or deciding that that's not the line of work that they want to be in. And when they come out, is the day that they graduate, they're on probation for 1 full year, so they can essentially be terminated without cause within that first 12 months that they've been hired. And after that, we own them via civil service. So that's kind of how that works.
Deputy Chief, you mentioned potential increase in field training. Is that going to be a post requirement? Is that why we think that's going to?
Yeah, one of our supervisors, the person that supervises the FTO program, Field Training Officer Program, went to a recent training, and they indicated that there's a lot more interface now between post and mass accreditation, and they're all starting to talk to one another a little bit more, and which is a good thing. It's not a bad thing, but with that, there will be some changes. And one of the changes I believe that's proposed, and I don't know if it was originated by Post or by Mass Police Training, but they suggested that a 3-month training would, not insufficient, but that we should look at extending it to closer to 18 weeks and even 20 weeks. So, and that changes the whole nature of, obviously, the hiring and training, and, you know, it lengthens the process that you're now waiting to make that person actually operationally useful as far as the schedule goes, you know.
Is most of the post-training after a person is hired in full-time, is that mostly coming through the state, or is that private businesses that are doing?
Training as far as
Well,
ongoing?
the chief has a lot of different training, but I assume the police also must.
So we're mandated to we have in-service training every single year. You have to qualify, you have to shoot your firearm, qualify with your firearm twice a year. You're not required to do defensive tactics training, but we do at least 1 day, sometimes 2 days of defensive tactics training, as well as attend in-service. The chief and I do it online, but most of our offices, we return them now to going in person. And those training modules are determined by Mass Police Training. Actually, the person who was the president of Mass Accreditation just left and became the head of Mass Police Training. So I would almost guarantee there's going to be a little bit more.
And the last part of that, the last part of that equation, Mr. Consilvio, is that it works on a 3-year cycle. So I have to sign off every year on a different group of officers based on alphabetical order, on whether or not they're a person of good moral turpitude, and I would validate them as a police officer and send that off to post. I can tell you that the previous town